Hello everybody, Dr. Redcross here. I hope all is well. We are bonding with our blood work, our lab tests. I say that's so important, and as you guys know, I always like to talk about the bond because it's important that you're bonding with your doctor so that when you get these lab tests, they make sense. And so what we started doing some weeks ago is to kind of go through a real lab test. This is something that when you guys leave the doctor's office, well, nowadays it's a little different. I'm a little more old school. You used to get your blood results to take and keep in your records. I know now we're using the portal. I've also talked about printing out some of the lab tests from the portal. Make it easier for me because I like when they're printed out and you guys get a chance to go home and to kind of write notes about some of your questions, especially when you see some of these things that are elevated and even some of these things that are low. Now, one of the important things when we're looking at the lab tests is to make sure that we are educated with each line item. And I talk about it being the same as with financial wealth. When you want to look at the line item of your stocks or the line item of your mutual funds, whatever that is, you want to understand. And most of us, we pick up and perk up and are ready to read the financial piece. Well, why don't we think of our health as money or value as well, right? I think we really should. And so what I'm trying to do with this particular series is that I'm trying to make you look at this as really like spiritual cash, right? Not religious, guys. I'm talking spiritual, in your heart cash. Because the healthier you are, the more you can do. If you want to think about it in the world of form, you can generate more money. But if you want to think about it spiritually, health is wealth, as they say, right? So what better way to stay healthy and really, really wealthy than to understand these particular labs? And so I know you guys are sitting there with bated breath. Drum roll, please. What are we talking about today? Well, we're going to talk about the FLP. Who knows what that is out there? It's a little bit of a tough one, so I won't hold too long. Your fasting lipid profile. Something else that when you go to your doctor, or at least every 3 to 6 months, you're going to get it, depending on what's going on. Or actually, sometimes once a year for some, but I don't like waiting a year for much. I worry, so I like to get on top of things early. So the FLP, the fasting lipid profile. So with the fasting lipid profile, everyone, why is this important? Well, look, we understand cholesterol. What happens when our cholesterol is elevated with the myriad of other issues? We know we can have heart attacks. We know we can have strokes. We know that we can have a myriad of challenges actually when you're thinking about your cholesterol. I don't want to dive too deep in this video because this video is really for the moment about you understanding when you get your lab results, what they mean. We can dive into cholesterol later. So just so you know, there are 3 types of cholesterol. I like to call them, when I'm speaking to my Spanish patients, I call it la buena, la mala, el feo. The good, the bad, and the ugly. You know me, I'm always positive, so the ugly is just there for you to kind of remember, right? So the good, well, better yet, let me let you know what this is, and then we're going to go to the good, the bad, the ugly, right? La buena, la mal y el feo. So the first thing here you're going to see on your panel is going to see just the cholesterol. That's your total cholesterol, okay, everyone? It's pretty easy. You look at a number. This particular one says 199 or lower is normal. That's fine, right? So what does that really tell us? Not so much, I don't think. I mean, look, obviously, if it's really, really elevated, it's a challenge or it's a problem. The reason why I say it doesn't tell us that much is because I want us to dive deeper. And so the good thing is this lab test for the FLP, fasting lipid profile, will dive deeper into those 3 cholesterols. So the first one I told you about is the good. So the good cholesterol, everyone, is called the HDL. It's a high density lipoprotein. Once again, we're not doing medical jargon because we talked about that. We're going to talk little digestible pieces. So it's called the HDL. So what I want us all to do is that I want us to envision a blood vessel. And the blood vessel is kind of like this, right? This is the top, this is the bottom, and the blood's flowing in the middle of this, right? So as we're looking at that, the HDL for lack of a better term, or just to remember, or lack of a better explanation, think about fat globules or what have you coming in the blood and trying to attach or adhere here, right? Trying to come in and block up in here. The issue with HDL is, think about it as making it greasy. Think about it as making it very difficult for that to kind of come and adhere or attach. I wish I had something nearby, guys. Not great, but think about this pen. And this pen is not allowed to come up here and cause a plaque formation, cause a blockage. So therefore HDL doesn't allow that. HDL makes it nice and slippery, right? So you can understand why, heck yeah, that's the good cholesterol, right? I don't want to have anything that's going to adhere or attach to the blood vessels in here, right? So the HDL, nice and slippery. Nothing can come here and attach like this. It will not be possible. So that HDL we talk about, you'll see it in a lot of panels at like 40 or lower. Now, it's interesting. There are some cool things to help bring the HDL up, right? We know that exercise is beneficial. It helps to bring that HDL up. So why wouldn't you want to exercise more so that you can make that nice slippery molecule that keeps cholesterol from forming a plaque, which can later become a blockage and cause a stroke or a heart attack? So if you know exercise can help increase that HDL, why wouldn't you do it? Maybe today you didn't know, and so maybe now you're exercise, because we don't want anything here. We want nice and slippery so that it doesn't happen, stays in the blood and gets out of Dodge, right? So think about the HDL that way. Looking here at this particular patient, this looks great. The HDL looks wonderful. The other thing is, I told you the bad. So we did the good, the HDL. Now we're going to do the bad. The bad here, everyone, actually, I'm trying to look at their number because I want to share it. Anyway, the bad is their triglycerides. I'm looking here. Their triglycerides look pretty darn good. And so I'm happy with that. What are triglycerides? Well, triglycerides, everyone, is kind of the food that we're taking in, that kind of cholesterol, right? Knowing that we're eating too much red meat, eating poorly, eating processed foods, things that we know we weren't supposed to be breaking down when we were cavemen and cave women, right? We weren't supposed to be eating anything. Let me step back here. Anything that leaves a powder on your fingers, you shouldn't be eating. It should be out in the garbage, okay? I'll use my little French, even though that's not really French, but you know what I mean. The point is, it doesn't belong in your body. So those sort of things, everyone. And our Western diet really makes a lot of cholesterol, and those things are kind of measured with the triglycerides. Once again, when I did that analogy before, remember that HDL help keeps it slippery. That triglyceride kind of keeps it hovering a bit. Potential to be sticky. Potential to really make it worse versus sliding off. So triglycerides, we don't want to get them high in our blood test when we're looking at them. Now, the good thing, like I told you with the HDL, pretty cool. We could bring up the slippery one in our cholesterol panel to help us stay healthy by exercise. What about triglycerides? It's double cool, because we can just watch what we're taking in by mouth. We can just make sure that we're eating right and doing our best. Now, look, guys, I want you to live. I understand that, and so I don't mean that, but my point is that for predominantly, I want you to be careful with how you're eating. So once again, you're seeing two of these things we can really control. Now, the ugly, right, is that of the LDL. The LDL tends to be the biggest causative agent of causing that plaque to come here and stay. And what happens when a plaque stays is a plaque can become very unstable and it can open up. And when this plaque here opens up, it's terrible. It's frothy. It exudes liquids and fluids, and it becomes almost like a mesh. And when it becomes like a mesh, guess what? Blood on this side can't get to the blood on that side, hence a blockage. And we see that as a heart attack, or we see that as a stroke. There's different types of strokes, but that's an example of how when there's a plaque here. And so that's why it's called el feo, the ugly, because the LDL, we want that thing low. and we want it low. And lots of times it'll say under 100. That's interesting because the LDL, everyone, it's a little bit probably too much for our talk now, but just so you know, we want it low. But we want it even lower in certain patients, those who have had a heart attack before. We want it even lower. We want to be very, very aggressive because they have proven to us that they've had a challenge or an issue with their cholesterol already, right? So obviously we want them lower than maybe someone else who is, pretty young and healthy, a little bit elevated, but we can bring it under the 100. So patients who have shown to us that they have some vascular or blood vessel challenges and blockages in the past, we got to be more aggressive with that. So therefore, you're understanding, I'm hoping, the good, the bad, the ugly. The good, which one is that? Help me out here. HDL, you're right. You guys are so smart. And the bad, somebody's saying it, I hope, triglycerides. Those are the ones. Can we control the HDL? And can we kind of control the triglycerides? It's an A. I was going to say it's an A-B question. A, yes, B, no. Well, the answer is A. I think you know that. And then the ugly, the LDL. Can we kind of control the LDL? Yes, in a way. LDL, everyone, I should also say, the ugly, is kind of how our body processes cholesterol. All of us are a little bit different, but we do know that there's an interplay from all of them. But as you're thinking about that, and now I hope you're understanding that yes, there's a total cholesterol on this lab sheet, and that's fine. It's like, okay, if it's elevated, great. But you want to know the breakdown now, don't you? Because it doesn't matter if your regular cholesterol is elevated unless we know the good, the bad, the ugly. HDL, triglycerides, LDL. HDL, nice and greasy, the way we're going to think about it to keep our arteries open. Triglycerides, cause a little bit of an issue, can be boiling a bit. So triglycerides, we got to watch what we're taking in with our foods. Not that simple only, everyone, but it's a big part of it. And the ugly is the one where we need to recognize our bodies all process cholesterol differently. They can process it in a way that can become really sticky and adhere or attach to that blood vessel and cause a problem. So now that you are better understanding your FLP, we've already said it. What is FLP? Fasting lipid profile. Oh, and I should say, lipid, everyone, another name for fat in a way, right? It's another name for a fat. So I guess you can call it, fasting fat profile, but that doesn't sound as cool and doctory, right? So fasting lipid profile, your FLP, you're going to have that. Oh, and I should say, recommendations will sometimes say you get that every 6 months, you get that every year. My folks with heart disease are going to get it a little bit sooner. My diabetics are going to get it quarterly. The point is, I just need you to understand it and really understand why it's so important for you. So, the name of the game here today, everyone, is to make sure that when you get your lab tests, you get them, and now you are closely intimate with your health. Now you're going to feel like that gold and platinum human being that I think all of you are, to make sure that we stay healthy and wealthy, because health is wealth, right? Even more important than those green things with big faces on them, right? It's really all about being healthy, and that's to be as wealthy as you can. So if you like this, if this is valuable and you get lab tests and other things that can be helpful for you, just let me know. I'm not that far away. Thanks to technology. So if you like it, subscribe. If you like it, share. Do all those good things. But more importantly, I just want you healthy and I just want you happy. So take care and we will talk soon. Hey everybody, Dr. Ken Redcross here. If you don't know, I love the patient-doctor relationship. It is so important. So my question for you is, who wants to live longer? We all do, right? So therefore, I've written 2 books. This first book is called Bond. It's the importance of trust, respect, empathy, and communication with your doctor, because I believe if the relationship is perfect, then it will help you live longer. But how can I really make sure you live longer? Well, I decided to write a second book. This is the 15-minute Bond Blueprint. This particular book helps you go minute by minute of your 15-minute visit to make sure you get the perfect doctor relationship and visit that you all deserve, to make sure we extend our healthcare journey.